my name's Lauren and this is Holly. We are both the senior research nurses here on intensive care at Great Ormond Street Hospital, and thank you very much for having us to speak to you today. We're really grateful to have been invited, and we hope we're just going to spend a couple of minutes just telling you a little bit about our day and how we operate, and a little bit about how we've changed our ways of working since the pandemic. So we are a relatively big ICU research team. We've got 5 nurses, a couple of doctors, quite a lot of consultants that have got different studies. We have 3 people in our non-clinical team, and we are very much based on the intensive care. So each day we need to make sure that we have a really good understanding of all of our open research trials. We try very much to do every research trial that we're approached for within reason. So we're very much a kind of can-do type team. So each day we need to make sure we've got a really good understanding of the open studies. We screen every patient across the 4 units. So that's normally around 40 to 50 patients crossed with around 10 open studies. We often screen multiple times a day. So if we have an admission in the afternoon, we'll look at them again for all of the open studies. We work really closely with the whole MDT, so ensuring that everyone is aware of the open studies, ensuring that everyone's happy for patients to be recruited to them, and making sure that people are educated enough about the studies to recruit out of hours if necessary. We work in a slightly different way to other research teams in that we operate a model called deferred consent in some of our studies. So that means that we need to be really, really clued up about GCP in emergency setting. So making sure that we're always the patient advocate, and while we do recruit to research, sometimes without consent, making sure that they are always informed wherever possible, and that they are an appropriate enrolment into the study. We manage the studies really closely, so from setup we'll make sure that we're confident that it can work in our environment. We'll try and make changes before we open the study if possible. When it's open and running, we will then check that it's working well. If not, we'll suggest some changes that we think might be able to be made. If that isn't possible, then we'll see how we can adjust the way that the ward works, always kind of trying to adhere to what the study requires. And after all of that, it's really important that the nurses are taught about the research that's going on in their unit so that they're empowered, they're able to randomise out of hours. So we really feel like research is important, that it's really visible in the clinical area, people are not scared of research, and so sorry about that. And that it's just a part of everyone's normal day, and that's what I think we feel really passionately about. Means being part of kind of a research hospital is actually, it's not something weird and wonderful that happens in a different department. It actually happens on a daily basis on the ward.
So consent with families is very different to us as compared to an inpatient and outpatient study. We consent families at the bedside in ICU, which we realise is a different way of consent for research. So we know that it's a very high stress environment for the families, and there's a lot of barriers to understanding with that. So our roles in particular is to support the families and make sure that they are informed about the research that we do in ICU, and that they have the time to consider the research trial, and that we support them whilst they're stressed at the bedside. Also, it's really important that we support bedside clinical staff, because they have to undertake research tasks within that. So we not only do we support the families, we also support the bedside team. So our role is really varied from day to day. We work in the nature of a 24-hour critical care environment, and we can be called at any time of the day. And I think during the pandemic, our flexibility has really helped with that. So we've had patients admitted at all times of the day, and we've worked as an MDT, and that's really having a team approach, and opening to a 7-day service has really helped with that, hasn't it?
Yeah, definitely. Yeah, I think that we found there were different stresses. So when opening to 7-day service, it means that you're automatically thinner on the ground during the week. So instead of going from four me working 4 shifts in every 5, I'm working 4 shifts in 7. So we had some different challenges with that as well.
Yeah.
So we also had, for example, staff sickness, redeployment, and we had nurses managing that, us as well, managing our own stress, us thinking about our own family that we hadn't seen for however long, and on top of that, our workload kind of tripling at times overnight. We definitely were keen to open every study that came through that was an urgent public health research study. So all of these things kind of came into play, but I think that our intensive care background really helped us with that in terms of having flexibility and being able to kind of chop and change at last minute.
And putting the patient first, knowing that families have multiple approaches for studies, and making sure that they have the time to think about the research and consent.
Yeah, and I think for the first time it was where we have recruited families to studies where we didn't actually know much about the illness. Before then, we would maybe study something in intensive care, but we would know a little bit more about the actual illness and the outcomes. And this was the first time where we were recruiting children into research studies where we didn't actually know what this illness was going to evolve to become. On top of that, we had families that were isolating at home, so we had children in the ward that were alone and consenting their families at home via Zoom, sometimes at midnight. So I think all of these things meant that we've actually walked away from this and we work in a different way now, a little bit more flexibly. We have come away with a real kind of can-do attitude.
And it's been really worthwhile.
Yeah, definitely.